Medicine continues to change every day, and the doctors responsible for this are now doing what they can to share this information and news. Introducing Regenerative Medicine with Dr. Escobar, a new approach to pain management here in Florida. Dr. Escobar is board certified by the American Board of Anesthesiology, the American Board of Pain Medicine, and diplomat of the American Academy of Pain Management. He has been practicing in the area for over 15 years. He has lectured in the community as well as mass media on various topics in pain management. As a leading provider of interventional pain management in Aventura, Pembroke Pines, and Hollywood, Dr. Escobar works hard at treating the source of your pain with the goal of restoring you to full function in your normal life and activities. If you wish to join the conversation or have a question, please call 888-565-1470 and talk with Dr. Escobar. Now, here is Dr. Escobar and today's show.
It's not. Hi, welcome back this week to the Regenerative Medicine Show with Dr. Luis Escobar, practitioner at Pain Care Specialist of Florida. Dr. Escobar es el doctor de los milagros. Dr. Escobar is a double board certified director of anesthesia and pain management. His practice is dedicated to interventional pain management. Dr. Escobar has 3 offices located in Hollywood, Aventura, and Pembroke Pines. Last week, we began unveiling the mystery of platelet-rich plasma and stem cell therapy for both regeneration and pain treatment. We spoke about Kobe Bryant and why he went to Germany for stem cell therapy. So this week, we're going to discuss the prevalence of knee injuries in this country and why stem cell therapy and PRP therapy can make such a dramatic difference in your treatment. But first, I want to talk for a minute to the silent sufferers out there. You or someone you know may be suffering from chronic joint pain in your back, elbows, knees, wrists. You don't have to go it alone. I want to invite you to join the conversation with the compassionate doctor who cares, the doctor who has done years of research before incorporating stem cell therapy and PRP therapy into his very own practice. Dr. Escobar is your partner in your healthcare journey, helping you to step back to your optimum performance and getting you back to your day-to-day activities with freedom, without pain, and without discomfort. As we speak with Dr. Escobar, remember that you can call in at any time to ask a question or to find out if you are indeed a candidate for PRP and stem cell therapy at 888-565-1470. And remember, you're listening to 1470 AM on your dial. You can find us live at Facebook, AMP2 TV Productions. That's AMP2 TV Productions on Facebook Live. Dr. Escobar, we missed you in the studio last week. We know you were up in Orlando at a wonderful convention, learning a lot of stuff.
Yes, we were. Tracy, thanks for having me again here at your show. And we were in Orlando, as you said, tried to get smarter.
Trying to get smarter?
Tough task. Taken back from last week, we talked about the treatments in Germany for Kobe Bryant, and we have to reiterate to your listeners that we wouldn't have to go to Germany to have those treatments performed. We can have this done here in South Florida very safely and effectively, both with platelet-rich plasma, which contains the IRAP, which is the substance that was injected into Kobe Bryant's knees as per his own account, as well as more advanced treatments with stem cell injections in the injured areas to obtain even better results.
So poor Kobe, he flew halfway around the world for something that could have been achieved in Dr. Escobar's office.
Well, not poor Kobe. I think he did very well, but yes, he could have achieved the same locally, yes, for sure.
So tell us, how did you get started with PRP and stem cell therapy. What was it originally that got your attention in that area?
It started when we were dealing with multiple injuries and trying to control patients' pain. And we were very successful at treating the pain, but we were not very successful at regenerating the injured tissues. So this was quite frustrating, especially with a younger population. You know, they're quite active and they want to restore their lifestyle. And we continued to study the options. PRP was quite popular back in the last decade, but I did not see all that great of results. With latest technologies, I mean, the processing of the platelet-rich plasma has improved dramatically. And with the introduction of better techniques to isolate stem cells, we're having dramatic response with this treatment. So we moved the practice into not only pain management, but regenerative medicine. So we are treating now the pain and helping our patients return to their normal activities with a healthier body.
So, Dr. Escobar, I think it takes a lot of courage to be a pioneer among new medicine. You know, especially one that may or may not be covered by health insurance. And I give you a lot of credit for pioneering this field. You know, like we said, you've been studying it for a very long time prior to incorporating it into your practice.
Well, thank you, Tracy. You know, it's not about me. It's about my patients. And when I see something that I believe in, and I truly believe that this helps my patients, and I have seen it work dramatically, then I'm happy to incorporate it into the practice. And it makes a huge difference. It sure does.
So you're seeing dramatic results using the PRP and the stem cell therapy.
I am. We have been able to avoid surgery to several patients that
That's
were
fantastic.
ready to go, like for meniscus surgery, for instance,
Wow.
which is one of the most common injuries. We have improved dramatically the pain on patients who had a facet disease of the spine with chronic pain, where we were able to decrease the symptoms, but patient would keep coming back because as soon as the medication were off, the symptoms will come back. Now with the regenerative treatments, the symptoms tend not to come back. I mean, the response is sooner, faster, and better, and longer lasting. So it is extremely rewarding to my patients and to myself. You know, it's very extremely rewarding to see them do better.
Yeah, it must be very rewarding to see them not only out of pain, but getting back to their active lifestyle.
Definitely. We don't really follow our patients outside of the office, but yes, they
Maybe that's the next Dr. Escobar study.
they do relate that the quality of life improves significantly.
Yeah, I'm sure. And you see patients that are seniors, and you also see patients that have athletic tears, let's say of the meniscus, or the golfers, the tennis players.
Yes, Tracy. We see patients from 18 years old to, as we mentioned in one of the previous shows, I think my oldest patient is 101 years old.
Wow.
We have
God
not
bless her.
we have not given him any stem cells. So he has excellent stem cells of his own.
Fantastic.
To achieve that age. But yes, we treat the whole range of ages and all type of injuries.
What other type of injuries have you treated?
Well, we restrict the practice to the musculoskeletal system. I'm sorry, and that includes all joints in the body, tendons, muscles. More commonly in joints treated is the shoulder, the elbow, the knee, the hip, and the ankles. We also treat the small joints in the hands as well. We treat the spine. We mentioned the facet joints in the spine, intradiscal, the soft tissues around the spine. Sometimes this patient with pain is not necessarily the disc or the facet, but maybe just soft tissue injury in the muscles and the tendons in the spine. There are multiple. patients who have had joint replacement. Sometimes patient may have the perfect joint replacement in place and still have a lot of pain afterwards. And these patients may be having pain because of the surrounding tissues that support the outside of the joint. And those patients respond quite well to regenerative treatments on those tendons.
So in other words, it not only can save, PRP and stem cell therapy can not only save you from having to have surgery, but it also can work in conjunction with surgery. It sounds like once somebody has had surgery, sometimes there are still issues surrounding their recuperation, their recovery, the pain management around the procedure. They might still be in discomfort. And PRP therapy and stem cell therapy can help manage that pain and get them out of that discomfort.
It definitely can. We mentioned in the past that the treatments are amenable to patients before, during, or after surgery. I say during, I do not perform surgery, but there's certain surgeons who are integrating the use of the stem cells intraoperatively to enhance the result of the surgical repair. When every injury and every trauma to the body involves inflammation, whether you have surgery or haven't had surgery. And the treatment with these biologics is aimed to decrease the inflammatory response and promote the healing response of the body. So it is a double-edged sword. The inflammation sometimes, even though it's a normal response, may be a negative effect in the body. Mm-hmm. So when you try to, when you are able to manipulate the way the cells work and which cells you want, where and why and when, then the results are much better than what the body can do. That with the extra benefit that we are giving many more cells, a bigger multiple of what the number of cells will be in that area.
Well, Dr. Escobar, we're going to go to our break in about a minute, but I just want to let our listener know, again, that you're listening to 1470 AM on your dial, and you can catch us live on Facebook Live, AMP2 TV Productions. And to find Dr. Escobar, he has three offices in Hollywood, Aventura, and Pembroke Pines. You can call his office at 954-322-8586 to find out if you are indeed a candidate for PRP therapy and stem cell therapy. If you have a question, please call us while we have Dr. Escobar here. Our number is 888-565-1470. Again, that's 888-565-1470. And you are watching the Regenerative Medicine Show with Dr. Luis Escobar. I am your host, Tracy Kawa.
Get your life back from musculoskeletal injuries faster and without surgery. At Pain Care Specialists of Florida, Dr. Luis Escobar can help you do just that with regenerative treatments of platelet-rich plasma and stem cells. Stem cells live in all of us and act like the repairmen of the body. However, during injuries, we sometimes can't get enough of these critical repair cells to the injured area. This is where Dr. Luis Escobar may help you by harvesting your own stem cells and re-injecting them into the injured area in need of repair. To find out if you are a candidate for regenerative treatments with platelet-rich plasma or stem cells, please contact Dr. Luis Escobar at 954-322-8586 to make an appointment at one of his 3 conveniently located offices in Hollywood, Pembroke Pines, and Aventura. Or visit us on the web, www.painconsults.com. You are listening to Regenerative Medicine with Dr. Escobar. And if you wish to ask a question or participate in the show, call 888-565-1470 and speak to the doctor. Now, back to the show.
Welcome back to the Regenerative Medicine Show. You're listening to 1470 AM on your dial, and you can catch us live on Facebook Live, AMP2 TV Productions. So, Dr. Escobar, again, is a double board certified doctor of anesthesia and pain management. And in our conversation a little bit earlier, we were talking about meniscus tears, and I have a really interesting fact that I found online. It was in the official journal of the Society for Academic Emergency Medicine. From 1999 to 2008, 6.6 million emergency room visits were had for knee injuries, and 2.5 million of those were sports-related injuries. I mean, those are whopping, staggering numbers that we see. And my question for you today, Dr. Escobar, is why do we have so many people with knee injuries in this country, and what can be done about it?
Well, why is because we are more active than ever before. We have the CrossFit, we have the non-fit, we have the weightlifting, we have the octagon. Everybody has these extreme sports, and they're doing very well. But all these sports are very demanding on your joints. Knees are extremely valuable, extremely flexible. It allows you to do a lot of different moves that are used in this type of sports, let alone the trauma on other sports. So the injuries to the knee are quite common. Meniscus tear are significantly common, and is the most common surgery performed. The repair on the resection by orthopedic surgeons.
Oh, really? It's the most common surgery performed by orthopedic surgeons?
Yes, it is.
That's amazing. Mm-hmm. So it's like an epidemic, really, of knee injuries. And we have an aging population. People are living longer, so more wear and tear on their joints, I would assume, right?
Yes. I mean, the more trauma to any area, especially the joints and the knees in this particular case, the more you're going to have degeneration of those areas in the joints. Like I said, I mean, we are by far more active and more aggressive on that activity. So the injuries are appearing more and more often and tend to be more serious. We want to address these injuries the earlier the better, with regenerative treatment whenever possible. You have two choices if you have meniscus injury. You can nurse it a little bit and go to orthopedic surgeon and end up with surgery, or you can nurture a little bit, go through stem cell treatments and allow your body to heal it without any surgery.
Personally, I like the most non-invasive option for starters, and I would think that most people would like the least invasive.
For sure, I would. Not all meniscus tears are amenable to stem cell treatment, although very few are not, but not all of them are.
Does that mean that they're not all the same? Tear related?
No, there are different type of tears.
Okay.
You have partial tears, you have radial tears, which are partial, you have the complete tears. The complete tears, depending on where the location within the meniscus is going to have more or better chance of recovery with interventional treatments such as stem cell treatments and platelet-rich plasma. Some injuries, there are complete tears on an area that doesn't have good circulation within the meniscus. It's going to be very difficult to heal through these treatments, but the possibility does exist.
Interesting. What I also think is interesting is that we're overactive, we're underactive. So we also have a very high obesity rate in this country. And I would think that would also be very debilitating to the knees and the joints that carry a lot of weight.
It sure does. Again, the meniscus are a risk, but also in this particular population that you mentioned, and the early development of osteoarthritis is also a big risk, and this can also be treated again with stem cell treatment together with platelet-rich plasma. It does, if you have mild to moderate osteoarthritis of any joint, in this particular case the knees, early treatment with these biologics may stop, in some cases, even reverse the development of osteoarthritis.
So, do you believe that, or is it known that if you tear your ACL or your meniscus, let's say when you're in your 20s, would that make you more prone or more likely to have the osteoarthritis later on?
A tear in the meniscus, tear by itself, will not promote arthritis unless you have loss of meniscus. If you have surgery and you have what is called meniscectomy, which refers to removal of some of the meniscus that it has been torn, in essence, what you're doing in that surgery is removing some of the cushion that is between two major bones of the body that carry pretty much half your weight.
The cushion that you need for impact.
Correct.
To absorb the impact and
Correct.
shock.
Mm-hmm. And by removing that, I mean, there's more tear and wear on the in the bones themselves. So the early development of arthritis does exist. So the early need for more surgery, in this case, joint replacement surgery, may be necessary earlier than would have been otherwise.
It sounds like a vicious cycle.
It is, when something breaks, something else follows.
Well, how can we use PRP and stem cell treatment to maybe interrupt, or as they say in the tech world, disrupt this vicious cycle?
Well, once there's an injury, we will love to treat that injury early enough to allow the body to regenerate so there is no more injury and we can return that joint to a more physiologic state and prevent the development of further degeneration of the joint.
And that can conceivably as well help you avoid surgery down, in the future.
If we're able to return the need to a more physiological state, yes, that will prevent the need for any more invasive surgery later on in life.
As well as prolong, perhaps, the life of the joint itself.
Exactly, yes.
Nice. So there's a lot of different professions that also have, that are more prone to knee pain.
Basically, any active lifestyle is prone to have knee degeneration. I mean, there's certain professions, like professional athletes, especially gymnasts or any contact sports, they're definitely more prone to have this type of injuries. Soccer, which is becoming more popular in the United States, even though it's the most popular sport throughout the world, is getting more popular in the United States, and it is very conducive to meniscus injuries as well as ligament injuries in the knees.
What about drivers of sorts? Whether it's equipment or truck drivers that are constantly bearing down on that clutch.
Yes, it does. Especially workers that use a drill.
The jackhammers.
The jackhammer is contact.
That's a shock to your body. that's a shock to your nervous system and the knees.
Not pun intended, but yes, and that is a constant chronic trauma to the joints, and pretty much that affects all joints in the body. Any construction workers, any weekend warrior, like to call them, they're also prone to this type of injuries.
So it's time that we start taking care of ourselves, our joints, staying healthy, eating right, staying light on our feet, doing what we can to absorb the shock in our joints, and calling Dr. Escobar when we think we might be a candidate for PRP and stem cell therapy to get us out of pain. So as we sum up this week, I want to invite our listeners who are watching us on 1470 AM or who might be tuned into AMP2 TV Facebook Live. I want to invite you. Why live in pain? Call now to find out if you're a candidate for stem cell treatment. Call Dr. Escobar's offices at 944-322-8586. The wonderful Dr. Escobar. You should read his reviews online. They are amazing. And he is a wonderful doctor who underpromises and overdelivers, which, to be frank with you, I'd much prefer a doctor who underpromises and overdelivers. Humble, modest, wonderful, and effective will get you out of pain. 954-322-8586. Visit one of his 3 offices in Hollywood, Aventura, or Pembroke Pines.
And please visit us at painconsults.com. We have plenty of videos on our website, educational videos, and you can contact us directly through the website as well.
So visit Dr. Escobar at www.painconsults.com. Again, www.painconsults.com. Visit Dr. Escobar and his wonderful staff at one of his wonderful 3 South Florida locations. Thank you for tuning in to 1470 on your dial or Facebook Live at AMP2 TV Productions. Catch us next week. We'll see you then.
See you next week.
You have been listening to Regenerative Medicine with Dr. Escobar. Join us every week for more information and news on achieving full function in your normal life and normal activities. Call Dr. Escobar for more information at 954-322-8586. See you next week on Regenerative Medicine with Dr. Escobar. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.